Retiree benefits are getting a tremendous amount of attention, and the Affordable Care Act is making the focus even sharper. The number of retirees covered by benefit plans is increasing, and the costs are continuing to go up. It's expensive for plans to continue to cover retirees, and it's expensive for retirees. The Affordable Care Act brings with it a number of new ideas and areas of interest that plan sponsors can consider when covering retirees. If someone is retired or doesn't have access to group health insurance coverage, under the Affordable Care Act, they can now buy coverage on a state health insurance exchange. These are also called marketplaces. And if certain household income thresholds are met, the government provides a subsidy to help them purchase this coverage. The Affordable Care Act also requires that coverage on a health insurance exchange be age-rated. The premium is adjusted for age, but within certain limitations. This means that for someone who's retired and not yet eligible for Medicare, the premiums may be very favorable on a health insurance exchange. And if someone doesn't have health insurance coverage and they're not yet eligible for Medicare, they will have to pay a penalty. For plan sponsors that are covering retirees not yet eligible for Medicare, they're going to want to take a careful look at how their benefit plans are structured under the Affordable Care Act, and now that the provisions of the Affordable Care Act are in place. In particular, plan sponsors may want to consider structuring a retiree-only plan. Plan sponsors are going to want to also look at how the coverage is provided, whether they use medical savings accounts such as FSAs, HRAs, or health savings accounts as part of providing retiree benefit coverage. Under the Affordable Care Act, we are seeing developments for Medicare. A lot of the changes have to do with the way providers are reimbursed and other initiatives. But we're also seeing the emergence of a private exchange marketplace for supplemental coverage or Medigap coverage for retirees. For plan sponsors, this means they have a number of new options to consider. But perhaps the biggest decision a plan sponsor needs to make when covering Medicare-eligible retirees today is whether to continue coverage on a group basis or to consider individual coverage, perhaps through one of these new private exchanges. Plan sponsors are going to continue to wrestle with the cost and the complexity of providing benefits to retirees. Providing benefits to retirees continues to be very important for many plan sponsors, and the Affordable Care Act brings with it some new ideas and options to consider. In particular, under the Affordable Care Act, we now have public exchanges, public marketplaces for those who are not yet eligible for Medicare, and we also have the emergence of private exchanges both before and after Medicare eligibility. With these changes and with a number of the options and alternatives under the Affordable Care Act, plan sponsors have the opportunity to take a step back, review the coverages that are being provided to retirees, how those coverages are being provided, and they can consider what options they have for the future.